Hi everyone, my name is Chris. I did a degree at Aston. I did biomedical science and achieved a first. And I've just now finished my first year exams and I'm moving on to second year with Oliver, who is my classmate.
Have you found the content of your biomed degree useful when transitioning to medicine?
I'd say for the most part, yes, the biomed background was really helpful for most of medicine. What I would add as an addendum is if you are coming from biomed, you've probably done a few of the systems in much more intricate detail than medical school usually demands of you. And I found in some places that can be a little bit of a hindrance because you want to go into more detail. But you have to remember that medical school, as well as just learning the information for you, and it is good to have the extra knowledge in there, you also have to be more exam-oriented in some respects and also know that some of the extra detail maybe it confounds the broad process they want you to memorize. So if you get too caught up in the detail you remember from your degree, don't prioritize that over what you're being taught now. If in doubt, always just go for what they're telling you should know. If you can remember the extra knowledge for your own purposes and to make you a better doctor in clinical practice, absolutely do that. But that's the main thing I'd say. Overall, yes, if you're coming from a science background, I think you'll have a few lectures where you sit down and say, I'm familiar with this content. Worst case, I forgot quite a lot from my first degree, but just being familiar with some of the words, just knowing what some of these enzymes were or recognizing the name of a part of an organ, for example, can really help orient you. So when you're not understanding a topic and some of it makes sense to you, it really does help you build the picture a bit faster. That's definitely, I think, the main feeling I had, even in lectures where I was getting a little bit lost. There's bits and pieces I was familiar with.
How have you had to change your study habits since coming to medical school?
Okay, so this one's quite a challenging one. I think this varies a lot from person to person because having spoken to people on the course as well, they seem to have adopted a lot of their old study techniques. I dropped everything I'd ever done. When you first have the first few lectures, they tell you that you cannot hold anything as sacred or given in terms of your study method. You have to be able to willingly throw away everything you've done before because it's a very different kind of degree. Things that worked previously might not work this time. And I sort of threw myself into that a lot because before I did a lot of cramming. I know that's not necessarily a great thing to admit, but my first degree went really well just because I'm good at putting stuff in a short period of time and then it falls out immediately. And obviously that's not the sort of doctor I want to be and the sort of medical graduate I want to be. So, and immediately I thought that was not going to work for medical school. So I tried a few things actually. Basically what I wanted was a method that would work to slowly but surely put the knowledge in forever rather than just cramming in at the last minute. And I'll say this right now, I don't know how about anyone else in the course, but I think cramming at a medical school is a very, very risky strategy. And I would highly recommend that you look at more long-term strategies for putting knowledge in there. So I think that's the main way I changed. I sort of changed my perspective from being very short focused to I want to pass this exam and then move on with my life to this is knowledge I want to retain in second and third year so I don't look like I know nothing about the body or embarrass myself in front of a consultant, for example. These are things you need to know forever. So I'd say, yeah, definitely. Things like Anki, taking long form notes and reading them, challenging, trying to do things with friends, so challenging each other, testing each other is good, going to seminars. These sort of things build long-term knowledge and you can start them really early. Definitely the thing I would advise to do.
Even though biomed will have a lot of core content overlap with medicine, what's something that surprised you with how challenging it is?
I think what really surprised me actually was definitely the people skills element of medicine. So obviously if you are coming to medicine, you do have, I'd say, some inclination toward being social. So you obviously are quite good with people. I would hazard a guess if you're applying to medicine, you want to work with the public. And I found actually some of the advanced communication that medicine demands is very tricky. You really have to learn new things about how to talk and communicate with others. There are very challenging situations, so people with dementia, people who can't quite understand what's going on. So I think a really big surprise came to me was I was asked to explain to a dementia patient who had suffered a stroke and had vascular dementia what had happened to them. And that was just something that never ever occurred to me as a scenario that could come up. So I had to sit down with them and explain what a stroke was. And that's quite a technical element. We've been taught this in very huge technical detail. But obviously when you're communicating to that patient, you have to throw away every single thing you've taken as a given about communication. And that was a definite moment for me where I realized that the sort of things I thought would be easy. So I like talking to other people. I thought that'd be a very easy part of the course. Absolutely not. You have to really be willing to look at things that you've thought were simple before in any possible scenario medicine can throw at you. And there are a lot. So I thought that was definitely the biggest one.
During your biomed degree, what sorts of things were you doing to improve your chances at getting into medical school?
Okay, so when I was doing my biomedical sciences degree, I took a placement year. And I sat down at the beginning of the placement year and I entirely planned this year to be about developing my CV. So on that year, I attached myself to a member of staff at the university I knew very well, and she allowed me to contribute to her paper. Unfortunately, I got published with her, which I thought was definitely one of the biggest scores in my on my application. So if that's anywhere possible for any applicants out there, I would highly recommend it. Talk to staff that you know well and like you. It is honestly the best possible avenue just to try. Additionally, I did a lot of volunteering at a local hospice. I think people are very obsessed with volunteering in hospitals, and I know a lot of people who applied with me did try to do so. And it's very competitive because every medical student out there immediately jumps to, I want to go and volunteer at a hospital. But I found places like hospices and care homes desperately needed staff and volunteers. We're very happy to have you. There was no ruthless competition. And I found the clinical experience it gave you was really, really unique. You do find out a lot of things. I think when you're shadowing as a medical student, you get to look and you don't really get to interact an awful lot because obviously decisions are too technical. There's a lot that you can't really get involved in. And care homes and, for example, hospices are places where you can be with my hands on. You can really talk to the patient. You can really get involved in every case. So I think a defining moment I had at the hospice, which compared to my shadowing experience was quite unique, was I had the opportunity to sit down and follow the same patient for a few days. And I think I sat down and had lunch with them a few times, and I really let me got to know their experience and their thoughts about their condition, about their care, how did they feel about everything, their life in general. I think I got a very deep analysis of one person as opposed to being shown cases and different techniques. I think when you're shadowing, there's an expectation that you're going to see a lot of different things, and the doctor or consultant will show you things that are interesting and then rush you on to the next thing. I think working in a hospice or a care home is good because you really get to know the patient on a very personal level in some cases, and you get to really develop a relationship with them in some regards. I don't know if that's the wrong phrasing. You get to sort of develop you get to develop a rapport with them over a long period of time. I think that was really moving. So at the hospice, there was a woman who I remember reading her chart, and it said low mood for the last 4 days, and I remember talking to her every day because I thought this was something that obviously I should be dealing with as someone volunteering there. I'm sure it was something that the doctors and the nurses had thought about, but probably wouldn't have addressed in the same way I would have if I was shadowing with them, for example. They might have just commented on it and moved on to try and show me something else. But at the hospice, I got to spend time with this person. I got to learn a lot about how they viewed their own care, their perspective on medicine at end of life, and how their family members had reacted and all that stuff. So I asked about how the news had been broken to them from their perspective, which was very interesting. It gave me a real insight as to how people like to hear how they hear these things, how they react, whether they have loads of questions or want you to just wait. And obviously in medical school, they teach you a lot about this, so don't worry, they will fill you in on how best to try and do these things. But their perspective was really fascinating about how they felt during the steps we've been taught. And I can go back and apply over the top what the doctor was doing. I think it was really useful just to know that sort of thing, just to know from their angle what it's like. I think as well, there's things that they tell you that you would never have thought about. So one of them was the frequency of visitors that they were talking about as well. I would never have thought to make sure they had something to do every day. And obviously the doctor's not really your job, but it was a huge part of whether they felt good or bad, or whether they felt like they should bother taking their medication, or whether they should give up. A lot was tied into things that as a doctor I would have completely overlooked if I was looking at them from a clinical perspective. And I thought that was very poignant. There's a lot to take away from that sort of minutiae that you wouldn't really think about.
If you could kind of change the past and go and tell your past self to study medicine at 17, is that something you would do?
If I could go back in time and go into medicine at 17, would I? Sorry. So if I could go back in time and tell myself to go into medicine, I'd probably say I wouldn't. I think I did a lot of growth in my first degree. I think I had a lot of progression to make academically. I think as on a maturity level as well. I've heard people talk about postgraduate medicine as a place for sort of late bloomers, they use it. I'm not a huge fan of that term, but I think there's some truth there. Some people come out of A-level and they don't have the tools they need to study at the level that medical school demands, and it is a very high level, so it's not just your typical sort of study routine that can get you through it. I think a first degree is really useful in this regard, just to try and get your legs, so to speak, because a first degree is challenging. No one's going to argue that, but it gives you sort of a bit of a slow glide up into the difficulty of medical school rather than the cliff edge I think you might face if you started at A-level. So I would say no, I really needed that time at my first degree to sort of get my legs, really, to try and understand how I best studied, to really sit down and critically examine what I've been doing before and what was working, what wasn't. I think that sort of honesty is really helpful.
What was your process for preparing for the UKCAT and the interviews? What was that like for you?
So preparing for the UKCAT, I definitely felt like practice was the best method, and everyone online seemed to agree that was probably the way you wanted to do these things. So I used Medify. I don't know if I'm allowed to say that. So I used Medify and a book full of old UKCAT answers that I found in the careers library in my university. It was a bit old, but it was definitely useful. And I did every single question in the bank. I think that was pretty much the only thing I did, honestly. I found that the tips they gave you, which were fairly brief, honestly, you could read through all of them in about half an hour and then just do them over and over again. Like some of them are just, a few of the sections are very instinct based, where if you have to have a good feeling about what's going on, and if you have the good intuition, you can answer the question very quickly. You pick up little tricks yourself just by doing things. I think the main thing is there's no one right way of answering these questions. You have to just find your rhythm and do what's right for you. And that's a very generic response that no one wants to hear. Everyone wants to just hear how you're meant to do it. But I found that you definitely develop your own techniques. So there's a few things that were very intuitive to you that you pick up on, and you can use them much faster than anyone else's method. Preparing for the interviews, this is the thing I like to do for every interview, is I write down a list of questions that people might ask me, and I pass it to a friend, and they write down all the questions they would think to ask me, and then they ask me those questions. So there's a few I know that will come, and a few they've written down that I've never seen before. And we do it in a sort of mock interview style, and then I respond as organically as possible to the surprise questions. And that's good because I think that sort of practice helps you, because it helps you not get thrown off guard by questions you didn't expect. It gives you a little bit of practice in an interview scenario about what you're going to say, how you're going to phrase it and pace it. I think the main thing I would 100% recommend everyone does is there's a few generic questions that they will ask you. So why do you want to be a doctor? Can you think of a time in your life where you showed leadership or any other positive qualities that are probably listed on the university website? I know they work at Warwick. And what I did was I wrote a Word document, and I wrote down by bullet points all those things, and I wrote an example for each one, what I learned from it, and how I would explain it to someone else. And I just did it in sort of short bullet point style, and it meant that I never struggled to find an example. I think the worst thing that could happen to you in an interview is if you're just sort of sitting there not saying anything because you can't think of a time that something happened. If you have a few go-to examples, you can probably twist and bend them into a few categories of questions. Just have a few on hand, know what you're going to say, and then you can save all that time you would spend thinking, really selling yourself, which is honestly the best thing you can do. Don't add that last bit.
Tell me about something you were worried or apprehensive about before starting med school.
So before I started med school, I was very worried about the workload. I would bombard every student from Warwick with the question, is it hard? How hard is it? How do you do it? I wanted reassurances that I would definitely pass. I think I was so worried about failing that I wanted someone to tell me it was going to be okay and it was going to be easy and you can manage it. And everyone gave answers to the point of, it is hard, but it is doable. And everyone was very solid on those 2 points, is that there's no way to trick med school into being easy, I don't think. And if there is one, I would love to hear it, but I can't think of any. And there's no way to get around the fact that it's going to take a lot of work from you, but it is 100% doable, in that most of the year find ways to approach it that gives good results. Even if they don't pass the first time, on the retakes there's a good pass rate, so most people generally come together and find their way to manage it. And the piece of advice I was given that I'll pass on because it helped me hugely is start early in your revision techniques. So I started at Christmas for the summer exams, and that gave me about 5 months of revision using Anki and other flashcard apps, and I thought that was really nice because it meant you could just keep the pace up. I think definitely establishing a pace of work and just slowly increasing it over time is nice because you don't have any shock, especially because toward the end of the year the workload decreases a little bit, so you can ramp the work up in tandem with that. I think that's definitely the best way to sort of manage your time. Don't put it off until the last few months. That's the only thing I would say. Start as early as possible reviewing your old material.
Did you always want to do medicine, or was there something else in mind?
Did I always want to do medicine? Actually, no. Medicine was quite a recent decision for me. After A-level, I was in a very academic low. I think I worked out the things I was doing wouldn't work for higher levels of academic challenge. And I got into my first degree, just about. And at that point, I really didn't know what I wanted to do because everything I thought I knew about my own abilities was wrong. And I was really questioning what I was good enough to do. And I think eventually, after sort of finding my rhythm again and knowing that I really liked the challenge of biomedical science, I wanted to do something I wanted to try something even harder. I wanted to see how far I could go, really. And medicine immediately called to me as something that was very difficult, but very, it's highly respected, isn't it? It's difficult and respected, and it's a job that is very high satisfaction. And I think it definitely fell in line with me as something I would love to do, but I'd always thought it was a little bit out of reach. I thought of medicine when I was before A-levels, but obviously after my results weren't as I expected, I sort of threw it off. I pushed it on the table a little bit. I thought maybe not for me. I'm not sure I necessarily have the discipline to do that sort of degree. But I think after sort of regaining my confidence, I really went back to medicine again as a possibility. What definitely drew it to me was definitely, obviously I wanted to help work with people. I wanted to do something that benefited humanity in a very direct way. I think that was something I really wanted. But most of all, I think I wanted something that was a challenge and was going to be something that really pushed me to be the best I could be for the rest of my life, really. I didn't want to get too lazy and rest on my laurels at any point. And that's what medicine really was like, in my opinion, the decision at that point. Like, that's really what turned me toward it.
What's been your favourite part of the Warwick course so far?
So I'm experiencing this one in that once I was there, the anatomy teaching on Friday, and generally lectures from an anatomy professor I did like being taught by were really good. That's compounded a little bit by the fact that my commute was long and I had to get up at 4 or 5 a.m. to get to the anatomy session, so obviously my mood wasn't fantastic. Yeah, I was living in Birmingham, so nobody who has these smarts to move to Canley/Coventry will have that problem. But I had an hour and a half / 2 hour commute, depending on if it was weekday or Friday, and it definitely put a damper on some of my spirits when I was doing some of the Friday teaching material. But I think overall it was fantastic because in America they call it pimping, and pimping is where the consultant asks you questions about anatomy, and you're just put on your toes. Do you know what this is? Yes or no? And Friday's a bit like that, but more of an organized sort of fashion, and it's not about showing you up as such. It's more about just saying, here it is on a person. Can you see this thing you've learned about in a textbook? I think that was super useful because on the exam and in real life, you will be looking at a patient, and all the textbook teaching in the universe can't help you if you can't find a nerve or a muscle on a person when you're looking at them and touching them and looking at the anatomy of them. That said, my favorite moment from medical school has got to be on the Tuesday clinical teachings. So that was really good for a similar reason, actually, where we were in clinic and the consultant takes you around, and in this case he does pump you a little bit, where he'll be like, here's the patient, read the chart, what do you think's happening? Tell me what you think is going on. When you get that sort of clinical diagnosis right, when you look at that chart and all the knowledge comes together, the anatomy and the physiology and the pharmacology, and you get a picture and you know what's happening. There's a sort of eureka moment that is very unique to medicine, I think. I've never really felt that sort of thing before. Maybe it's the sort of thing you get when you solve a very hard puzzle, for example, but like it all comes together and it gives you this real feeling of clarity that what you're learning is for something practical and important. I know first year feels like you're getting bogged down in textbooks and exams and yield and all that sort of terminology that I'm myself quite fond of, but it is good to be reminded every so often that what you're learning is a practical skill that is applicable in everyday life, that is one of the most in-demand skills on the planet. Like, everyone needs doctors, and when you're sitting there looking at a patient and you know what's going on and you have an idea of what you're meant to do about it, it really does make you feel a little bit like you are already on the career path, even though it seems so distant. You can feel for a second what it's a little bit like to be a doctor, and that is a really nice feeling, like 100%. That was a real big high in my medical school career, was sitting down with a patient. I think it was a patient who had dizziness and like blurred vision. He was like, what's going on? And I looked at it and I instantaneously knew what was going on, and I remember the name of the artery that had been clogged by the stroke they'd had, and I looked it up from the chart and I thought, there we go, finally, all these things I've been taught that were just individual factoids have come together to give me a picture of a real person who has a problem that I now understand. And that was a great feeling. That's a really unique high you get from medicine, I think.
If you hadn't made it here to medical school, what do you think you'd be doing?
I really considered working as a paramedic. So I worked with St. John's Ambulance for a while, and I was looking into the paramedic route going from St. John Ambulance. And I know a friend of mine is a paramedic as well. For the work he described sounds like a lot I would enjoy, for the same reason I would enjoy working as a doctor in A&E, for example. I think there's a lot of overlap. And I met paramedics while I was working in A&E. I wanted to talk to them a lot more too. First of all, to just improve my clinical skills, but also, as you said, like it was me thinking about what I might do if it all goes horribly wrong. I could definitely see there being a very satisfying career as a paramedic. I really thought about it. I think it'd be great.
Have you had any thoughts about specialty?
So, in terms of specialty, I was a little bit unsure going into medical school, but I was immediately drawn to A&E. Like, I like the sort of fast-paced work. I know from lab work, before in the sort of laboratory environment, when everything was sort of going wrong and no one really knew what to do, I like that sort of chaos. I like stepping into that sort of disarray and trying to sort it out, or having answers and solving that problem in the moment. I like the sort of immediacy of it. I like seeing the results of your labor as fast as you can, really. And I like being able to go home and know that there's nothing hanging over me, really, nothing to really think about. What really sort of got me a little bit was sometimes I overthink things a lot. I think if you're that sort of person, medicine might be quite challenging because you'll think about your patients and the decisions you made and what was right, what was wrong, and maybe sometimes you don't know. I think A&E sort of appealed because you do find out fairly swiftly if what you're doing is right, and you get to go home knowing that you have done X or Y good things. You get a very instant feedback, so to speak. And all the A&E doctors I spoke to said a similar thing, and that's why it appealed to me.
What is your perception of our colleagues on the course that come from non-science backgrounds?
So, in my opinion, the people from non-science backgrounds get it a bit faster, in my opinion, because they have understood a simple concept that everyone has to understand when they come to medical school. and that is that compared to what you've done before, the comparative advantage you get from any of your experience is relatively minor. You can't breeze through it. The people who come from non-science backgrounds already know and accept that it's not going to be easy for them. I think a lot of people who come from biomed, myself included, were a little bit on the fence of whether this was going to be really hard or whether I could just sit back and rest on my laurels for some of it. And the answer to that is a firm no. You absolutely have to be on it very quickly. I think the non-science people apply themselves 100% from the get-go because they expect to be behind and they act as if things aren't going necessarily well. And honestly, I would advise, even if it sounds very stressful and negative, I would advise working as if you are approaching everything for the first time if you can. Don't use your experience as an excuse not to work. Use it as a foundation to plan your work. That is my advice. And I think the non-science people have an advantage in that regard because they have no false impressions of their own ability whatsoever. Thank you very much for listening to me. I'm happy to field any questions you have about applying to medicine or what it's like at medical school, or questions about taking the UKCAT, which I know is a very stressful experience for all applicants. So if you want to shoot me an email at the email address Oliver is splashing on the screen somewhere right now, I will happily field your questions. And good luck with the applications.